So I sent a letter out to all of you about what the Noble New Way is and kind of how we came about. It's a movement that was not intended, but that came about because we see so many assets in Noble County, and we realize that even people that we call the theys of the world have a lot of assets and gifts and skills and abilities to share. I think we're seeing that come out so clearly now in all that's happening with COVID. But as we were working together as a team, Rick Ferrant with Northeast Indiana Works came across a small TV station down in Grant County that started addressing the local stories. And part of that is what's happening on the front line in the local area. So we hear the state statistics and we hear the national statistics, and we see some of that here in our own county, but we wanted to hear directly from the people who are dealing most closely with this right here in Noble County. So Terry, if you can start us off by giving us a little bit of an overview of the phases of reopening and where we are currently and where you see this headed here in the next couple of weeks for Noble County.
Right now we're in stage 2 of reopening. The governor has outlined the stages that are expected to be happening over this next month and a half. And each stage is approximately 2 weeks or so. Right now, we've allowed, we were at the stay-at-home stage, and in spite of some cruising events and things like that, we did reasonably well with that. People stayed home. They stayed out of social gatherings, and the level of infection in our community was largely based on the idea that we had 2 outbreaks in our local nursing homes. That's where all the deaths also occurred, is among those 70 and 80-year-old people that were vulnerable and succumbed after contracting this disease. It's true that they may have died with or without, but this kind of tipped them over the edge. And some of them were certainly not anywhere near death before developing this virus. And then the baseline has also included a number of people, the 2 people from West Noble that were hospitalized and on ventilators temporarily that have now recovered, at least to a large degree. They're still rehabbing. And we've had a group of people in Ligonier who went to Goshen Hospital, and it's a kind of a multi-level family affair that's a mini outbreak over there. But in general, being a rural county, we've been, we're kind of social distanced automatically. That is, we're people tend to stay in their family units and get together on maybe Sundays or social events or school. And so we haven't had an enormous number of people outside that, just a few here scattered here and there. People who travel and so forth. This last week, we had some opening up of the community. People are able to get out of their houses and gather in small groups. Still not large groups. Still, the people who are 60 plus it's still recommended that we stay home, and so we'll see how that goes. The problem is that as far as the virus is concerned, nothing has changed. It's we still don't have a vaccine. We don't have a treatment. We just have more experience with it than we had before, and Consequently, there's really no good reason to think that opening up the society and bringing us back in contact with each other is going to have a different result than what it was beginning to have when we first shut down the unity. And so, you know, a lot of people travel to Fort Wayne for work and so forth. And as they start going there and coming back and bringing the virus with them and coughing on each other at the local restaurants and that sort of thing, we can expect that we're going to have more episodes, more people that are ill. We're also seeing from a national standpoint things that we didn't really necessarily expect initially out of this virus, in that it's causing problems with coagulation. It's causing, and this week's column is about rashes that are COVID related. That I'm supposed to be writing this afternoon, so we'll see how that goes. But then the next steps will gradually allow people to be more and more in contact with each other, and you can read the sequence that the governor's office put out. But the idea ultimately is to have no restrictions as of July the 4th. You know, big parties, great idea. You know, it's like a breeding ground for a virus. And if we're lucky, if we're really, really lucky, then what will happen is that that we'll have the seasonal changes that we see with influenza, for example. And so it won't be so bad when things open up, if they do indeed open up in July. However, if we start seeing a surge in people that need hospital beds and so forth, or a surge in the death rate, then I think that things will be rethought, and the powers that make these decisions are going to need to decide whether or not we should continue on to the next phase, either to extend the phase that we're already in. The problem is that there's about a 2-week lag time between when you do something and you see the result, especially with regard to the respiratory failures that we see. Those seem to happen in the 9 to 10 day range after symptoms first start. You get a cold-like symptoms or flu-like symptoms, may feel better after several days, and then a percentage of people, a relatively small percentage, but still real, develop extreme shortness of breath and desaturation of oxygenation in that week to 10 days range. And then you know, then it's hospital time. The hospital has the hospital system, Parkview system has they kind of geared up for the surge, and now have kind of backed down a bit in comparison to the incident command has now been kind of backed down on. The county has an incident command, and we are still monitoring the situation, but we haven't had to be aggressively involved so far, because the stay-at-home plan was as effective as it was. The emergency departments have not been overrun, partially because the social distancing has kept people from spreading strep throats and colds and all the other things that we normally see in urgent cares and in emergency departments. And then, and of course, there is that factor of, well, perhaps people are afraid to go to the emergency department because they might catch something there. I'm not sure that that's really the case. It's hard to say that. You know, if you stay at home instead of going out and you know, mowing your lawn or raking leaves or whatever, maybe there are less heart attacks that happen. But as people get more active and aggressive, maybe those things will come to the surface, or maybe they've been going on silently since then. You know, strokes and heart attacks are down as well. So I could ramble on for about 5 hours, but I think that you've kind of, I hope you have the gist of this thing. I don't believe that we'll be fully open on July the 4th, but you know, it's really not my decision ultimately, because I don't think that if the governor says we can open up by July the 4th, I think people are antsy enough about doing, you know, getting back to normalcy. I think that it would, no matter what I say, they're going to do it anyway.
Yeah. So we hear one of the controversies right now is kind of like the vaxxers and the anti-vaxxers. We have the maskers and the anti-maskers. Where are you? I know I kind of follow what you gave us in the newspaper, where you said when you're walking the trail, you've got it right here. If you see someone coming at you, you put it up. So what do we tell people in Noble County about masks?
Yeah, the answer is relatively simple. The mask is not to protect you, it's to protect other people from you. We don't know whether you have the virus or you don't have the virus, because some people are up to 50% of people have no symptoms. And an example of why we believe that is because on the USS Roosevelt, where they had the outbreak, they tested everybody, and they found a whole bunch of people that were positive, but who never really had any symptoms. Now, admittedly, they were all, you know, 20-year-old males or female, you know, the predominance of males at least, and they had relatively mild symptoms or no symptoms at all, and still tested positive for it, and really never developed the symptoms, but certainly had the virus. That being the case, we know that, or we believe that there are non-symptomatic. The word asymptomatic, I think, has now entered most people's vocabulary, but I want to make sure that it's clear. Asymptomatic means non-symptomatic. So those people are out there, and potentially you or I could be one of them. And if we are, and we cough or even talk to somebody close up, we may spread droplets containing those virus particles, those virus their RNA actually, and if we spread those in the droplets that we spray at somebody else, then they may not have as good a time as we do. You know, if we're asymptomatic, they may be symptomatic and get into a lot of trouble. So we wear the mask if we can't social distance. If we can social distance, if we can maintain 6 feet between us and other people, then we should do that, and certainly you know, follow the washing hands and coughing into your elbow and all those other things that we've heard so many times. But you can't really maintain social distancing by, you know, in a restaurant or other places. So you should wear a mask when you can.
Thank you. Jamie, do you want to speak to us about what it looks like on your front line at Lutheran Life Villages? We sure have been keeping you guys in our thoughts and prayers, and would like to hear from you about what it looks like on your front line.
Well, I think that we've seen the worst here. We have one unit now currently that has been past their 21-day isolation period. They're in the recovery phase now, and then we have 2 that are in various stages of that right now. Much to what Dr. Gaff said, this disease, this virus has not presented itself in the way that the media stated that it would. About 50% of the people that we've tested, we tested the whole building per state recommendations, have been asymptomatic. We would not have ever have deemed these people positive had we been going on a symptom-based strategy. But having tested everybody, we see a myriad of symptoms. We've had a handful that have gotten very sick, and we've got a handful that have had loss of appetite, no fever, We have some, like I said, that don't have any symptoms at all. So this has probably been the worst thing that I've ever faced, being the director here at Lutheran Life Villages, and I think that probably will be the worst thing that we've ever had faced. Like Dr. Gaff said, we're losing people. You know, that certainly their hours and days were limited with us, but probably would have a longer time with us here had this virus not hit us. So
What can we be doing for you?
I think we've gotten great support from the entire community. I mean, everybody's checking in with us all the time. Dr. Gaff calls us pretty much daily. We can bounce ideas off of him, and you know, we've been sharing results just to making sure that we're as transparent as we can be during this time. Obviously, you don't have nurses and aides that you can send me to help when we've got
Right.
people out on the front lines who
Yeah.
either think they're sick or may be sick. It elicits a certain amount of anxiety amongst the staff, and then, you know, even if they don't have all the symptoms, you know, they certainly start thinking that they do. So we've tested a lot of employees that have been negative, and certainly there's a certain, you know, amount of other viral load that's going on right now too, that's making people sick with certain symptoms that they think they might have COVID and they end up not. But we have had Parkview reach out. We've got one Parkview leased employee right now that we're using. She's been a great help to us. And the other campuses have been great support in getting us the staff that we need. So somehow we're making it work. I don't know how, by the grace of God, I think, but it's been difficult.
I'm sure it has. I'm sure it has. Carrie and Audrey, what does it look like for you at Parkview Noble?
You know, we definitely are seeing our share of COVID patients, not nearly onto the level of what Lutheran Life is seeing, but you know, we are testing patients. We're seeing them come in, just the sickest patients that I've ever seen. Symptoms, I think, are changing. They're not the classic, you know, cough and fever as they were when it first started. So things are changing a little bit. So we never know. We treat every patient. You know, we protect ourselves. We protect our patients as much as possible. You know, we're still seeing our everyday things. I think people with the everyday illnesses are waiting longer to come in, which also complicates things, you know, for them too. And, you know, I hope that we can get that message across that, you know, for them not to wait, for them not to worry, you know, to come in. We keep everybody as protected and separate as we possibly can. I think the hardest thing is seeing these patients come in without visitors. And knowing, you know, if we have COVID positive patients, and knowing that they go upstairs, and knowing that, you know, ultimately what the outcome is going to be, that they don't have their loved ones there with them. I think that's the hardest thing possible for everyone.
Wow. Sure feel for you guys out there. I don't know what we can do for you other than keep praying for you, and you know, just stand with you as much as possible.
Absolutely, we appreciate that.
Audrey, what would you like to comment on any of the Parkview frontline? What's your position, Audrey?
So I'm the nursing educator here at Parkview Noble. So I initially started with a lot of staff training, and then kind of transitioned to a leadership role with their incident command. So I may not have direct hands-on care, but I'm kind of second line there. Yeah. I'll second what Carrie just said. I mean, we're having some of our sickest patients come in, but I also see some of the best nursing staff right now stepping up and just kind of like you were talking about for the nursing home, filling in any role that they can to support each other and to be the best facility for our patients in our community to come to. It's been really, really neat to watch.
Yeah. So asset-based community development is about taking our strengths to strengthen those areas where we are weak. It doesn't immediately focus on all the negative that's happening in a community on any given day, and not even in a COVID type of situation. So where are you seeing, and you just said part of it, you're seeing people step up, and you know, and Jamie said it too, I don't know how we're doing it, but we're doing it. You know, those strengths and abilities coming through when absolutely no idea how it's happening other than just sheer will and strength and the grace of God. What are you seeing? What positives would you leave Noble County with? Any one of you now, what positives would there be? I know here at Common Grace, it's like people just pop in and step in front of the window and hand us a check, and we don't know it's coming, and it just comes out of the blue. There are a lot of things like that are happening here. What's happening for you on those front lines? What are the things that keep you going day to day? Any one of you.
I think especially when incident command was in full force, things would change almost on an hourly basis, especially when things first hit. And, it was so nice. Anytime we would have a problem, you would say, today, things were very unexpected. One day we would have, we couldn't keep up with the phone calls that we were getting, into the ER from, worried people, worried everyday people of whether or not they should go to work or what to do with their kids. And each time we had a problem, we would, there would be a solution. Somebody would, the famous lines were, okay, we'll fix it. We're working on it. And they would, and the next thing you know, we've got somebody popping up from a different department to help us answer phones. Or, if there were supplies that we needed, somehow, they showed up.
Good. Jamie, what are those things that keep you going?
Oh yeah, we've had a huge outpouring from the community. When it first started, of course, we had everybody donating the cloth masks. That was huge, just people coming and saying, we can do this for you. People feeding us, just keeping us hydrated with, with snacks and just messages. We've had people driving through with cavalcades of well-wishers and people rooting us on and things like that. Of course, our organization has been amazing throughout all this, with, hazard pay and benefits for people that needed babysitters and just really going above and beyond to make sure that we're cared for as staff while we go through this.
Wonderful. Terry, how about you?
Well, I was raised on a farm 10 miles from where I live now, and have always known everybody who I grew up with and who I've associated with over my entire life have been uniformly helpful and willing to work. And so I think this is a continuation of that. I believe in my friends and neighbors, and in times like this, they come through. So it's my job to come through for them, and that's what we've been trying to do. And so yeah, it's just all part of that. The asset, the biggest asset in the world is other people, and so we just look to those other people and say, I really need this, and my experience is that we come through for each other, and I'm just hoping, and well, I expect that it will continue to be that way, because from my standpoint, it always has been. So you give and you get, and that's the reason that I live here, and that's the reason I raised my children here, and it's like, these are my friends and neighbors, and I appreciate them.
I agree, Terry. I grew up here too. I've lived here my whole life, and when I took the job at Common Grace, I knew there was need. And when I've been asked, what's your greatest surprise? I mean, even growing up here, it is the absolute generosity of people who step up in Noble County. I mean, it's overwhelming sometimes to watch people. Right now we've had people going above and beyond what even they thought they could do, and using, our neighbors that come because they need food in our food pantry, but they heard me say my gloves are on back order, that we use for handling food. And the next time he came, he had found a little stash of gloves at the auto parts store. And every time he comes for food, he brings us a bag of gloves. Just those little things. Those are the things that I think, I have this shirt that EDC gave me that says "Love Where You Live" and has a little Noble County emblem in the O. And certainly I can agree with you on that Noble County has just been amazing in how they've stepped up. So we really appreciate you coming on to do this. We'll probably do more of these. This is, we liked the idea of Noble County people hearing from people right here in Noble County, and not just hearing how hard it is, but also hearing that there are those little things that keep us going every single day, that where people are stepping up and using parts of themselves that maybe they didn't even know existed until now, when that opportunity has come to step up. One of my friends who writes a lot of grants, just like I do, said that he started writing when they would ask, what's the greatest need? He writes the words, the need to be needed, because we all need to be needed. And that's all of us. It's not just the us or the they or the them or the whoever. All of us have a need to be needed, and we need to have a purpose. And asset-based community development allows that purpose and that need, or that desire to rise to help someone else really to shine through. I think we've heard that today. So we really appreciate all the time you guys have given us. And certainly, Lutheran Life, I'm right across the street from you right now. And if there's anything that we can be doing for you, Parkview, the same. I've not had anything but good experiences when I've had to be at Parkview. I will admit that I laid my head open and I did not go to the emergency room because I decided a scar didn't matter. So there you have it. I'm one of those people that decided, no. So it's good to hear that that's a safe place to be now, and hopefully I won't have to think about that again, but we do sure appreciate all that you are all doing on those front lines. God bless you. And, just stay safe. We're going to work really hard to stay safe and to follow all that you all encourage us to do to keep those that you're caring for safe. So have a wonderful day. Thank you so much. We appreciate your time.
You too. Thank you.
Bye.